Well, I'm pleased to present the argument that integrase inhibitors and other antiretroviral drugs are really not themselves responsible for weight gain. These are my disclosures. By way of background, we know that untreated HIV infection leads eventually to profound weight loss, so what we used to call AIDS wasting syndrome. So initiating antiretroviral therapy in previously untreated persons with HIV reverses this weight loss and causes weight gain as a return to health, really back to the normal weight that people ought to be. In addition, at least in the United States, we know the typical American gains between 0.5 and 1 kilo per year from early to middle adulthood, resulting in obesity over time. It's also clear that attitudes about body image and ideal body weight vary widely across different cultures. These data from the National Health and Nutrition Examination Survey conducted by the US Centers for Disease Control and Prevention show the average weight over different age groups. And you can see how the typical adult male goes from about 185 pounds to 202 or 3 pounds. And the typical woman goes from about 162 pounds to 170 pounds between the ages of 20 and 50. Now, antiretroviral therapy can have an effect on this weight gain in surprising ways. So first, let's look at what happens in people without HIV infection. And there's good evidence that tenofovir in the disoproxil fumarate formulation is associated with weight loss in a series of PrEP studies. This is a meta-analysis conducted by Andrew Hill and his team, and it shows clearly that there was a significant odds of having at least a 5% reduction in weight in people who were randomized to TDF, usually TDF plus FTC, as compared to the placebo group in a range of TDF-containing PrEP trials. In addition, in the Discover study that compared FTC TDF to FTC TAF for PrEP, we see some surprising results. In contrast to the typical weight gain that would be expected over time in a population of young adults, remember that this study was done in MSM and in transgender women, we see that there's essentially no weight gain over 96 weeks with maybe a half kilo at the very end. And by comparison, the individuals who were in the TAF arm had about 1.5 kilos weight gain over 2 years, still a little bit less than might be expected for this age group. So the notion that TAF is promoting weight gain over and above what might be expected is really hard to justify. Now, granted, there's no control group here of people who received no antiretroviral therapy. It's also conceivable that people in this study were unusually physically fit and paid greater attention to their weight through diet and exercise. There's no evidence from this study any increase in weight from a TAF-containing regimen greater than what would be expected in the population as a whole. Now, if we look at the GEMINI study, which is the study of dolutegravir 3TC versus a traditional triple drug regimen with TDF-FTC as the nucleoside combination together with dolutegravir in treatment-naive people, here we see the 144-week follow-up. And what's notable is that everyone is getting dolutegravir, so they're all receiving an integrase inhibitor, second-generation INSTI, but there's a substantially lower increase in weight in the people who also received TDF, as you can see in the orange bars. This was true at both 96 and 144 weeks, and it was true in men and in women. So there's clear evidence that TDF is somehow weight suppressant. In the TANGO trial, which was a switch study in people already on a suppressive regimen that had to be on a TAF regimen, and they either continued on their TAF-based regimen or were randomized to dolutegravir 3TC. Overall, there was about a 2 kilo increase in weight across both groups over 144 weeks. Again, somewhat less than might be expected for this age group, and no significant differences, although there are some minor differences within different weight groups. So obese people had slightly different trajectories than people who entered the trial who were underweight or normal weight. If we look at SALSA, another switch study, this took people on any regimen, didn't have to be a TAF-based regimen. You can see the breakdown in regimens over there on the right-hand side. There was a greater increase in weight in the dolutegravir 3 TC arm, but that's because they started off slightly lower weight than the group that was on that continued on their baseline regimen, who had started with roughly 2.2 kilos more weight, had a slightly lower weight gain. At the end, there's about 1.5 kilo difference between the groups, which was not statistically significant. Most notably, if you look at those who continued on a TDF regimen versus those who had a baseline TDF regimen versus those who did not, there was more weight gain in people who were stopping TDF, again, suggesting liberation from some weight suppressing effect of TDF. The drive shift study looked at, again, a switch trial in people who were suppressed on mostly boosted PI regimens, a few on boosted L-bictegravir, and around a quarter on other non-nucleoside RT inhibitors. You can see that at the in this longer term follow-up of that looked at early versus delayed switching, we can see that there was an increase in weight as people shifted off of their boosted PI, suggesting again the boosted PI is causing a suppression of weight gain, perhaps because of diminished appetite. And here in this TAF switch study, we see that there is a transient increase in weight during the 9 months around the switch to TAF, and then a stabilization that resumes the previous curve of increased weight over time. So in summation, weight gain is common amongst adult populations. Weight gain upon initiating ART in persons with HIV is due at least in part to return to health. Some antiretrovirals, such as boosted PIs, tenofovir, and possibly efavirenz, have a previously unappreciated effect on limiting weight gain. This apparent excess weight gain associated with second-generation INSTIs and TAF reflects loss of this suppressive effect.